Hi, I'm Andrea. I'm really excited that you chose Strive Pharmacy for your compounding needs. Welcome to the family. Today, I am here to explain to you how to do a subcutaneous injection. So a subcutaneous injection just goes into that top layer of fat, just below the skin, just for technical terms. Most oftentimes you'll receive a box because a lot of these medications come on ice. One thing to remember is if the ice packs have melted, that's really okay. The medications are going to be fine and stable within that box for a few days. Once you open your box, you will see that you have your prescription that's going to have the medication, information about the medication, the directions for your medication, and injection materials. Prior to handling any injection materials, please make sure to wash your hands with soap and water. Your injection kit will contain alcohol swabs, insulin syringes, as well as an information card as to how to do these injections. So you can always reference that. Our insulin syringes go up to 100 units. A lot of times, some of our medications, you're only going to inject 5 units. That's right, it's gonna look like a very small amount, but it's gonna be significant enough for you. You'll notice on this syringe, there is not a 5-unit marker. So you just have to choose the spot between the 10 and the 0. There is a little line for that. Take a moment to read the directions as to how many units you will be injecting with each injection. You'll lift up the vial and pop off the blue lid. One thing to remember is that blue lid is not going to go back on, and that's fine. At this point, we are going to wipe the vial with an alcohol swab. After you've determined the number of units you will need to inject, you will remove the orange lid from the bottom. You will pull down to the number of units that the doctor has prescribed. So you draw down to the 5 with air. Take off these orange caps. It's important to not touch the needle. This will then be injected into the vial through the rubber stopper. With the plunger, inject the air into the vial and turn everything over. At this point, you'll want to make sure that the tip of the needle is within the liquid in the vial. Draw back with your plunger just past the amount that the doctor has prescribed because you may notice there's a few air bubbles in there. Using your finger, tap out those air bubbles. Before removing the needle in the syringe, make sure that you are at the correct number of units that the doctor prescribed. Once you remove the needle in the syringe from the vial, you can place it on the table on top of the lid such as this, keeping the needle from touching anything. We're going to determine where you're going to be injecting your medication. With a subcutaneous injection, the most common places to inject are going to be your abdomen or your upper outer thigh. You're going to prepare this area by wiping it with an alcohol swab. Once the area is clean, you will pinch the area of skin, inject the needle at a 90-degree angle, and over a couple seconds with the plunger, push the medication in. At this point, you'll withdraw the needle. You can use a scooping method to replace the cap on the needle. At this point, you'll place your syringe with the needle capped in a sharps container. You did it! You did a subcutaneous injection. Thank you so much for your time today. I hope this video helped make you feel more comfortable about giving self-injections. Remember, you have an injection information card within your box, so you're always welcome to reference that. And if you have any additional questions or concerns, you can always contact Strive Pharmacy. You'll find our number on your prescription. Have a wonderful day.